Hello and welcome. Thank you for joining this video series to learn about Medicare and your insurance options. My name is Kelly and I'm with the INTEGRIS Health Partners Plus marketing team. Here are the topics we'll be covering. Medicare, when and how to enroll, original Medicare premiums, benefits and what it doesn't cover, and your options for additional coverage. Then we'll talk about INTEGRIS Health Partners Plus, powered by Community Care. We'll show you the benefits included in our plans and then go over your enrollment timeline. And of course, my team is here to help you. The phone number will be visible throughout this presentation. INTEGRIS Health's mission is partnering with people to live healthier lives, which is why we're excited to offer this plan. So let's get started with Medicare. In this section, I'll talk about Medicare, what it is, when to enroll, how much it costs, and what it covers. Obviously, I can't go over every possible situation and circumstance, but I'll give you the basics, and if you need more, call and talk to one of my INTEGRIS Health teammates and we'll get you the information you need. So, people are generally eligible to enroll in Medicare when they turn 65. Some people are eligible due to a disability, but for simplicity, we'll talk about those that are aging in. If you are turning 65 and are not covered under an employer plan, either as an active employee or the dependent of an active employee, you will need to enroll in Medicare A and B. If you are still working or covered by someone that is and have insurance through your employer, you may be able to delay your Part B until you leave your employer coverage. So if you have questions about whether or not to delay enrolling in Medicare, you can call us and we'll help you find the resources that you need. Okay, let's move on to how to enroll. If you started collecting your Social Security or Railroad retirement benefits early, you will be automatically enrolled in both Medicare A and B. Remember that if you are covered under your employer plan, you can delay your Part B. If you did not start your Social Security benefits early, you should take action before you turn 65. You can start the enrollment process as early as 3 months before your 65th birth month. You enroll in Medicare through Social Security. You can enroll online at ssa.gov. You select Medicare from the menu and then you'll find the Medicare application. You can also enroll in person at your local Social Security office. If you're over 65 and retiring, you will have an extra step. You'll need to apply for Part B and provide proof of coverage in order to enroll to avoid penalties and waiting periods. Call my team and we'll get you the forms and the information that you'll need. Now let's talk about the cost of Medicare. For most people, there is no premium for Part A because you paid for that through your payroll taxes. Part B does have a monthly premium. If you're receiving your Social Security or Railroad retiree benefits, your Part B premium will be automatically withheld from that. Keep in mind that Part B premiums are higher if you were a high-income earner. You'll be notified if your premiums have an income adjustment. You can also find more information about the rules for high-income earners on the Social Security website. So, that's what original Medicare costs, but what does it cover and what are your out-of-pocket costs? Now, Part A is the hospital coverage and Part B is medical. Part A would cover things like an inpatient hospital stay, hospice, skilled nursing. Part B covers services like doctor's visits, durable medical equipment, outpatient surgeries. Together, Part A and B are original Medicare. So if you only have original Medicare and need medical services, you'll have deductibles to meet, and then a 20% coinsurance, and there is no limit to your out-of-pocket costs. If you have a lot of medical services during a calendar year, that 20% can really add up. There are also limits on the number of lifetime inpatient days you have and no coverage for medical services received outside of the United States. There's also no coverage for routine dental or vision exams, hearing aids, or outpatient prescription drugs. So people generally want to add some type of coverage to their original Medicare, and that's what we'll cover next. You have a couple of different options to add to original Medicare. One is a Medicare Supplement Plan or a Medigap plan, and the other is a Medicare Advantage plan, also known as Medicare Part C. We'll start with Medicare Supplement or Medigap plans. As the name suggests, these plans supplement original Medicare. In other words, Medicare pays first, and then the supplement will pick up most of the balance. But if Medicare doesn't cover a service, the Medigap plan generally doesn't cover it either. So you still may lack coverage for things like dental and vision care. And you also still don't have coverage for your outpatient prescription drugs. Those are covered by a Part D plan, which is a drug plan that you can purchase from an insurance company. Some people choose a Medigap policy for the freedom it offers. You can see any doctor that accepts Medicare, so you have a lot of options for your medical services. But that freedom does come at a cost. When you have freedom to see any doctor you choose and very little out-of-pocket expense for your medical care, you'll pay for that with higher premiums. In addition, the premiums for a Medigap plan are generally based on your age and sometimes your health conditions. So that means that as you get older, your insurance premiums continue to rise. And if you couple your Medigap plan with additional insurance plans like a dental and a vision plan and a drug plan, that's a lot to keep track of. So let's move on to Medicare Advantage plans, or Part C plans. A Medicare Advantage plan combines original Medicare benefits and usually your Part D benefits under one umbrella, and they often include additional benefits for routine dental and vision coverage and more. Medicare Advantage plans are contracted with Medicare to administer your Medicare benefits. What that means for you is that the plan pays your claims. Medicare pays the plan a monthly fee when you join and no longer pays your medical claims. So a Medicare Advantage plan will feel very familiar to you. When you go in for services, you only show your plan ID card. You put your Medicare card away. And you show the same card for all of your covered services: medical, dental, vision, pharmacy. One plan, one card. Medicare Advantage plans typically have low or no monthly premiums, and the premium is the same regardless of your age. In fact, the same plans are available regardless of age. If you have Medicare due to a disability, you're eligible for exactly the same Advantage plans as those that are 65 and older. And your premium is not dependent on your health. Now, because the monthly premiums are low on these plans, there is a trade-off. With Advantage plans, you will have some cost sharing for most of your medical services, and you generally have a network of doctors that you have to use to maximize your benefits. Medicare Advantage plans generally are authorized to sell their products to residents of certain counties, so to be eligible to enroll, you must live within the plan's service area. Your insurance choices are personal and can be complicated. You'll want to look at your provider choices, what hospital system you're most comfortable with, what you can afford as far as monthly premium or out-of-pocket costs, what additional benefits are important to you, and your prescription drug costs. It's a lot to navigate, and my team is here to help you find the best fit. Now that I've shown you the difference between Medigap and Advantage plans, let's talk about INTEGRIS Health Partners Plus. INTEGRIS Health is Oklahoma's largest not-for-profit health system and has served communities across our state for more than 100 years. The mission is partnering with people to live healthier lives. One of the ways we're striving to achieve this is by offering this provider-owned Medicare Advantage plan. INTEGRIS Health has partnered with Community Care to administer the plan, which means that you have the strength of INTEGRIS Health with the experience of Community Care to offer a provider-based health insurance plan for Medicare-eligible individuals in our service area. Now, INTEGRIS Health Partners Plus is an HMO. That means that you must get your care from network providers for the plan to work. In other words, you cannot choose to see doctors that are not contracted with INTEGRIS Health Partners Plus. This is usually where we get the question, so what happens when I'm traveling? The answer is you take us with you. With INTEGRIS Health Partners Plus, you have worldwide coverage for both emergency and urgent care, just as you would when you're at home. So with our plan, you have peace of mind to know that regardless of where you are, you can still get the care you need. So now let's look at your options with INTEGRIS Health Partners Plus. We have 3 different levels of coverage: Choice, Deluxe, and Premier. Choice is a medical-only plan and does not include Part D. Now, most people need a plan that includes both medical and Part D, so we'll cover Deluxe and Premier first. You'll see here a list of common medical services and the copays for those services. First, you'll see the copays for doctor visits, and then emergency room. Remember that you're covered worldwide for emergency and urgent care visits. No need to call us first. If you're out of the service area, you just go to the nearest facility. Next, you'll see that urgent care has a range of copays. With these plans, your copay is waived if you have a virtual urgent care visit with an INTEGRIS facility. The higher copay is for in-person or out-of-area urgent care visits. Moving down the chart, you'll see the copay for outpatient surgeries, outpatient diagnostic services. Next is inpatient hospital. You'll see the inpatient hospital copay is per day. If you're in the hospital longer than the number of days shown, INTEGRIS will pay the rest of your covered services for as long as you're in the hospital. There is no limit to the number of inpatient hospital days. Below that are the copays for outpatient rehab and diabetic testing supplies. Now let's talk a little bit about what the maximum out-of-pocket is. This amount is the most you will pay during a calendar year for your covered medical services. It's an accumulation of your copays throughout the year. Once you reach the maximum out-of-pocket limit, INTEGRIS Health Partners Plus pays the rest of your covered medical services in full for the rest of the year. Now let's look at the Premier plan. You'll see here that the monthly premium is higher than the Deluxe plan, and as you would expect, the copays are lower than the Deluxe plan. As you review these benefits, I will remind you about the urgent care copay being waived if you use the virtual option. You'll see lower copays for specialist visits, outpatient surgeries, and hospitalization, as well as a lower maximum out-of-pocket amount. Now we'll look briefly at our Choice plan. This is the plan that does not include Part D. Many people on this plan have access to either Indian Health or Veterans benefits, so they don't necessarily need a Part D plan. But we do have many members on this plan that just don't want a Part D plan, and that's fine. Anyone can enroll on a medical-only plan, but we do want to make you aware of two things. Number one, you cannot add a standalone Part D plan to this Choice plan. And number two, if you don't have a Part D plan when you're first eligible for Medicare and you don't have credible coverage through another source like VA or Indian Health, you will be penalized when you do enroll in a Part D plan later. The penalty is about 35 cents per month for every month you don't have drug coverage, and it is a forever penalty. So be mindful when you're making your choices about your drug coverage. Okay, so here are the common benefits of the Choice plan. You'll see that the copays for Choice and Premier are the same. The difference between these two plans is that Choice does not include a drug coverage, and it does have a higher medical maximum out-of-pocket. These are obviously the more common benefits that most people use. If you have questions about specific copays or need more information, be sure to reach out to our team. So now let's look at the extra benefits included on our plans. You'll see that our plans include coverage for comprehensive dental, vision benefits, over-the-counter benefits, and a wallet benefit that lets you choose the benefits that are important to you. Don't forget, if you need more information, give us a call or check out the summary of benefits on our website. Let's shift to prescription drugs. This can be a big factor to consider when you're deciding on your health insurance options. Regardless of how you get your Part D coverage, whether it's a plan like ours where the Part D is included or it's a standalone drug plan, they all have these 4 stages. Here are the Part D benefits for the INTEGRIS Health Partners Plus plans. You'll see that there is a deductible that applies to tiers 3, 4, and 5. In the box, you'll see the copays for a 30-day supply of your prescriptions while you're in the initial coverage limit. What you pay depends on what tier level your drug is in. It's important to check the plan formulary for your maintenance drugs so you'll know what to expect. Most people stay in the initial coverage limit throughout the year, but there are other stages of Part D coverage that you need to be aware of, and they're based on the total cost of your prescriptions. We send you a monthly statement that keeps track of your total drug costs. This is what you pay plus what we pay, and if you reach the initial coverage limit, you move into the coverage gap, or the donut hole, where you pay a percentage for most of your prescriptions. The next stage of drug coverage is the catastrophic level. Moving to this level is based on your total drug out-of-pocket costs. These include the deductible, the copays you paid during the beginning of the year, and what you paid in the gap. If you reach that level, you are in the catastrophic level where you pay a reduced cost for your prescriptions, and that carries you through the end of the year where everything resets. A word about this. Social Security does have a program called Extra Help or Low Income Subsidy. Eligibility for this depends on your income and somewhat on your assets. The income limit is not as stringent as it is for Medicaid, so we encourage anyone interested in this program to contact Social Security to see if you qualify. You can apply anytime. If you do qualify, you'll see a reduced premium for your plan and lower drug costs. And that's a look at INTEGRIS Health Partners Plus benefits. Again, I showed you the more common benefits. If you need more information, call my team and we'll be happy to answer your questions. Now we'll talk about how to enroll. Generally, when you enroll in a Medicare Advantage plan, you are locked in for the calendar year, meaning that other than some special circumstances, once you choose a plan, that's your plan for the year. So you want to make sure that it's the right plan for you. The things we recommend people look at when selecting an insurance plan is your doctor in network. What are the costs of your maintenance drugs? are the monthly premiums and copays affordable? Once you have those answers, you're ready to make your selection. You can submit an application for INTEGRIS Health Partners Plus up to 3 months before your effective date. And the application process is easy. You can enroll online, download an application from our website, call us to request an enrollment guide, or simply call us and we can enroll you over the phone. We're happy to help, and we'll make the shopping and enrollment process as painless as possible. Thank you for visiting us today. Choosing your health plan is important and personal. Call us if you have any additional questions or register to attend a seminar at a location near you. We look forward to hearing from you soon.